Hi everyone, I'm Dr. Andy Wee. I'm an orthopedic surgeon from Singapore. I practice in Mount Elizabeth Hospital and my main area of subspecialty is in shoulder and elbow conditions as well as sports injuries and arthroscopic surgery, also known as keyhole surgery. So the rotator cuff injury is one of the commonest reasons why a patient comes and sees us for shoulder pain. And the rotator cuff is essentially a group of 4 muscles that envelopes the shoulder joint and insert into the humeral head. So a rotator cuff injury can occur as a result of trauma or as a result of just wear and tear, especially in the older patients. And this injury can range from mild strain, also called tendinitis, or it can mean a complete tear of the rotator cuff. Most patients with rotator cuff problems typically present with 3 main symptoms. Firstly, pain, and this typically starts off with pain with overhead activities, but gradually as the disease progresses, it can even result in pain at rest or pain at night that disturbs the patient's sleep. The second symptoms that they may notice is stiffness of the shoulder, where they find it difficult to reach different parts of their body, especially with dressing. And last of all, weakness. When the rotator cuff tear is significant in size, this can result in significant weakness and the patient finds it difficult to lift their arm up to certain functional positions. Without proper treatment of a rotator cuff injury, a fairly minor injury like a rotator cuff strain or tendinitis can progress to a tear. And of course, a very small tear can also progress to a larger tear. And when you have a larger rotator cuff tear, there can be quite significant pain and disability. Of course, with a larger tear, it's also harder for us then to repair the tendon, especially if it's long-standing. Rotator cuff repair surgery has made certain advances over the last few years. Firstly, we have better implants that we use to repair the tendon. Secondly, we have got better surgical equipments. And last of all, we can do this now in an arthroscopic rather than an open fashion. More recently, we have a new implant. This is essentially a bioinductive implant, and it's very attractive because it can be inserted in a keyhole or arthroscopic fashion and used to augment where we repair the rotator cuff tendon. And the advantage of this bioinductive implant is that it allows faster recovery and it minimizes re-tear of the rotator cuff. There are several steps that you can take initially. So first of all, I would recommend avoiding the use of the injured shoulder to minimize further injury to the shoulder. Secondly, I'll recommend perhaps taking a course of anti-inflammatory medications, and this can be available with any visits to any doctor. And thirdly, if physiotherapy is available, then a course of physiotherapy would be very helpful in trying to regain function of the injured shoulder. If, of course, the symptoms in your shoulder worsen despite all these treatment measures, then I would recommend that you come and see us if the opportunity allows.